Cartilage serves to, from a joint standpoint, it allows the smooth motion of the joint, and it's very interesting. The coefficient of friction, or how easy the cartilage slides on itself, is better than ice on ice. So good healthy cartilage, the knee or the shoulder or whatever joint it may be, is allowed to function quite nicely because of that design. So cartilage in the body is specifically, we'll talk, cartilage restoration is most common in the knee. So we'll talk about the cartilage in the knee. There are two cartilages in the knee. One is, and I'll use this knee model, one is articular cartilage. And this is the cartilage that's on the, like the end of the chicken bone, the white stuff on the end of the chicken bone. That's articular cartilage. So when this goes away, people get, we term that arthritis. That's like the cap of the bone. So when this starts to wear away, that is considered arthritis. The other cartilage is the meniscus cartilage, and that won't be the focus of these talks, but those are the two types of cartilage in the knee. Cartilage can be damaged in many different ways. One of the most common ways is as we mature. So as we get a bit older, oftentimes in the genetic makeup, we're just destined to get arthritis. From a cartilage restoration standpoint, that's really not the group of patients that we're dealing with. Those patients are more the resurfacings, knee replacements, partials, etc. The cartilage restoration group is typically on the younger end, and when I say that, younger than 40, and that's the group where it's more isolated cartilage defects. So when somebody gets arthritis, for example, and I'll use this knee model, it's oftentimes the entire, say this is the condyle, it's the entire condyle or the entire knee. Okay, so with cartilage restoration, you're looking at very specific areas. So say, think of like a pothole in the road. So the rest of the cartilage is normal, and there's just one area that's like a pothole, and those are the types of knees that are candidates for cartilage restoration. In my training, one of my professors used to always say that cartilage was worth its weight in gold, because once it is gone, it's gone. The body does not regenerate cartilage. So the cartilage restoration is ways that we as surgeons or providers can regrow or put into place new cartilage. There's a few techniques that we do, and I'll kind of go over there some of the first line techniques. And one is, many people have already heard of this one, but it's called microfracture. So if you've got one isolated area of cartilage, you can take a little awl, and what it is a little, it almost looks like an ice pick. So you take a little ice pick and you poke holes in the underlying bone, and what happens is the bone will bleed, and it will bring in bone marrow and all the constituents that help sort of regrow that area, and it forms a cap. Now what we know, the downside of that is it's not true articular cartilage. So it's not like the regular cartilage. What is called is fibrocartilage, which is not quite as sturdy, not quite as resilient, but nonetheless it does form a cap, and that itself helps the knee significantly and stops swelling and can decrease the pain in the knee. With the cartilage restoration, oftentimes the first line treatment could be a microfracture. That's the first one. The second one is called OATS, O-A-T-S, and what that is you're sort of borrowing from the knee. For example, there's certain parts of the knee that have cartilage that's not used with regular walking, running. So think of it kind of like extra cartilage. So what you can do with an OATS procedure is you harvest the cartilage from the part of the knee that you don't use, and you put it into a part of the knee, where the pothole is, for example. So that's called an OATS transfer, O-A-T-S. And the one other option is using a cadaver cartilage. So basically what you do is you get a size match knee from a cadaver, and you take a plug, essentially the exact same spot where you have the cartilage defect in the patient, and you put the cadaver piece into that area. And what really is rate limiting on that, obviously, is with the cadavers that you can do any size. Or if you have OATS, if you have a really big lesion, there's not enough cartilage to transfer, so an OATS might not be a good procedure. However, the cadaver is very big, and there's no size restraints based on cadaver. And the final option for these is basically either juvenile cartilage or growing your own, sending it out to Boston. It's called ACI, which is Carticel, which is another technique that we can use. Yes, physical therapy is very important because a cartilage restoration procedure is it's a big surgical procedure in that you're going to have, whenever you're in the knee, you're going to shut the quadriceps muscle down, so that's going to need to be built back up, and therapy does a wonderful job doing that. Typically, the recovery time, the first 6 weeks, you're pretty slow because we want to protect that cartilage, so we're off of it for a good 6 weeks. You're on crutches, and then we get therapy going quickly, though, so we get the motion. Oftentimes, these will have a CPM, which is a machine that's called a CPM, which is continuous passive motion. So you're in a machine that actually bends your knee, and that's very important for the health of the cartilage. So total recovery time from a cartilage restoration procedure is 3 to 6 months. Yes, the cartilage restoration is very successful. It's very attractive as well because there's really no other way to treat these cartilage defects other than just time. And unfortunately, what happens is these defects can get bigger, involve more of the joint, and then unfortunately what they can result in is just beginning to degenerate. Patients get early arthritis, and then what that means is they're going to get resurfacing or knee replacements sooner and at a younger age. The cartilage restoration, that's the exact reason we're doing it, is to prevent further damage to the knee in the future, and therefore prevent bigger operations in the future.